More millennials are taking the plunge and getting Botox, even those as young as 18 years old.
The injections are being used as a skincare regimen. Amanda Shotsky joining us now in studio with a closer look at why this is all happening. Amanda.
This has been quite the talker. Now, could selfies be to blame? Well, maybe. In part, doctors say more and more patients are asking for that photoshopped look, but mostly millennials are using Botox to prevent aging skin rather than trying to get rid of wrinkles later in life. I sat down in the patient's chair at Cosmetic Laser Dermatology in UTC to see what the hype is all about.
Definitely sunscreen and just a kind of a light night cream.
At 28 years old, Lisa Johansson has a strict beauty regimen when it comes to taking care of her skin.
I definitely wash my face twice a day at the end of the night, 2 cleanses, 3 cleanses, get all the makeup off.
It's a routine that also includes regular Botox injections, something she's been doing since she was just 22.
It's always, you're so young, why are you doing it? Or you don't need it. Yeah, it definitely makes me a little bit more confident.
And when was the last time you had treatment?
Just about 3 months ago.
And she's not alone. According to the American Society to Aesthetic Plastic Surgery, Botox treatments for people between the ages of 19 and 34 has increased by 41% in recent years.
And a lot of my friends have done Botox, different fillers, and things like that.
At Cosmetic Laser Dermatology in UTC, Dr. Kimberly Butterwick says she's definitely seeing a trend.
Well, it's interesting. In the past 5 years, the number of millennials that come to our office has doubled.
The treatment, commonly known to smooth the appearance of wrinkles, is now being used as a preventative, relaxing the muscle movement to keep deep lines from ever forming. The younger you are, the less you need.
Now, if they start in their early 20s and they get the muscle to slow down, they are never going to have the deep 11s. They won't have the forehead lines.
Dr. Butterwick attributes the spike in millennial patients in part to the fact that it's a generation immersed in social media.
Not only do they look on social media, they take a lot of selfies. They notice little flaws earlier than they might have because they see their picture all the time.
As I am 33 years old, I just made it into the millennial generation, so I'm going to get my first round of Botox, and we'll see what the results are.
And you're going to have your first little Botox injection. 1, 2, 3, pinch.
The procedure only takes a few minutes and is virtually painless.
Oh, that was nothing.
But what about the long-term effects? Some are concerned that not enough is known about using Botox over a lifetime. Dr. Butterwick claims that it is safe, pointing to herself as someone who's had the injections for the last 20 years. While it's not for everyone, the doctor says taking care of the skin is essential, wearing sunscreen and not smoking.
Aging is a function of our genetics, but a lot of is our environment.
For now, Johansson gets Botox every 3 months, a routine she plans to keep for the foreseeable future.
I don't do it for anyone else other than myself.
So I've come closer to you guys to get a better look at what this looks
glowing.
like.
Not that you had anything to worry about,
No.
but yeah.
No.
I mean, it's preventative, of course.
And truth be told, it takes about 2 weeks for you to really see results. So
That's what I've heard.
today you wouldn't.
Now,
really
what
notice
does
anything.
something like that cost?
So there is a very wide range. It can range between $150 to $1,000. Depends on how many units you get and how many times you go. But it really just depends on what you need at that time.
That's right. Botox is measured in units, right?
That's right.
I see.
That's
So
right.
some of the millennials may need lesser units, perhaps?
Well, that's the whole theory, is
Yeah.
that because they are younger, they don't need it as much. And so you can get less at a time and less overall. So whereas some people would want to go every 3 months, you can really go twice a year and be just as fine. And Lisa, the woman that we spoke with, the patient, she said that the doctor said that she only was getting about half of a dose that she would give any other patient.
Okay.
Wow.
And are there concerns with all of this? I know the doctor said she's been using it for 20 years on her own face and she's doing fine. But as far as any long-term concerns, if you keep going after year,
As far as safety is concerned?
Yeah.
She claims that it is completely safe. And she says that she's been using it for 20 years. She said it is a safe product. The real concern that people have is that it is addicting because it does wear off after 3 months.
Yeah, right.
So that is something obviously that people will need to control. But I mean,
don't overdo your
don't
Botox,
overdo it. Although that is a good mantra with anything in life. So
You can tell when people overdo too.
right, right.
Less is more in this case. Less
Exactly,
is more.
exactly. And that's what the doctor said too. She said, we've now finally come into an era that is, the natural look is back. Because I think that people were scared of Botox early on because you had that like frozen face look.
Yeah, they don't want to give you that frozen face.
Right.
That's the goal.
All right, Amanda, you look great.
Oh, thank you. Thank you.
Thanks so much.